I am going to once again become a patient myself. I have developed a little basal cell skin cancer. Not a big deal. It's literally about a yearly process for me. Either have a squamous or a basal cell need to be removed through what's called Mohs surgery. I am not a dermatologist, but I'm fortunate to have a very good one. But if you're my age or older, you grew up in an era where sunscreen was lacking. I can just remember, either they were all alcohol-based and stung like crazy, or we had zinc oxide, just that white war paint that hardly probably did much of anything. But obviously I was an active kid and I got lots of sun exposure, and I'm paying the price for it now. But anyway, my plea and point of putting this out is make sure you get your skin checks. I've made pleas. There's just some basic common health things. Women osteoporosis screening. Please don't let that. Everybody colonoscopy screening, but skin checks especially. It's such a treatable condition, and you just don't want to let it get too far out of hand. I'll share it. I want this surgeon to remain completely anonymous, but someone I knew, I looked up to, unfortunately lost his life to melanoma. So get an expert. Don't mess around, particularly if you think it's a melanoma. I'll leave some of the sort of characteristic traits of melanoma up here on the screen, but that's one you certainly want to be wary of, and just make sure you get regular skin checks with a dermatologist. The fine folks at Westlake Dermatology allowed me to film my Mohs surgery. I just want everyone to see what a simple, straightforward, and painless process this is. This is Dr. Nikki Dieter, a board-certified dermatologist and Mohs surgeon. Mohs surgery is unique in medicine, and it's the only procedure in which the surgeon actually does their own pathology. She will in real time look at the excised tissue and determine if the margins, the edges, are free of cancer cells.
They're clear.
The edges and the deep margin to make sure it's all clear.
You can. So this is your epidermis, and I'm just getting it to where it lies flat.
This is Rosie, a derm histotech, and a darn good one.
Because she has to read your margins and your details.
She has the very important job of preparing the slides that Dr. Dieter will look at under the microscope.
Freeze it into a hard block.
First, they have to prepare the tissue by freezing it. These are called frozen sections. By freezing it, the tissue becomes a very hard, rigid block, so they can cut it into very thin slices, just like your neighborhood deli slicer. Rosie has to delicately handle these very thin, fragile specimens and place them on slides.
And then I have all of your slides as well, A, B, C. So she knows as soon as I grab, and then when I go deeper into the block.
This small conveyor belt takes the slides through the various staining media that allow the tissue to be more clearly visible.
She comes in and asks, I tell her going down the mountain, and she knows it's 7 minutes. Yeah, and she cuts it like a Pac-Man. I don't know if you can see the little mouth. We call her Pac-Man.
The Pac-Man allows them to maintain the orientation of the specimen, so if they need to go back and excise more tissue due to more cancer, they know exactly where to remove it from, so they can remove as little tissue as possible.
Purple band around, that's your epi.
So if there's skin cancer still, I'll see it under the microscope.
So it's back to the waiting room for me and back to the microscope for Dr. Dieter to take a look at the specimens. So you can very clearly see under the microscope these irregular purplish cells called basal cell carcinoma with very irregular nuclei. Unfortunately, on round 1, she determined the margins weren't clear, so it was back for round 2 and more tissue excision. Since she knows exactly where on the specimen the tumor cells were located, she can excise directly in that area while removing as little tissue as possible. So one final trip back to the waiting room, one repeat analysis under the microscope for Dr. Dieter, and goodbye cancer. And it's back to the exam room for the final stage to close me back up. Dr. Dieter does an excellent job in her suturing, and I'm out of here.
We're done. 2 hours in and out the door. Not too bad. Good job, Dr. Dieter.
The whole thing was really completely painless. And the advantage of being a surgeon, well, you can take out your own stitches a week later. Okay, well, thank you. Fast forward 10 days now. And as you can see here, I'll zoom in on it. It really looks quite good. And in probably 6 months to a year, I think it'll hardly even be noticeable. They do such a nice job in closing these. The reason I just want to put this out there is for people to see how simple and how easy this is, but how terrible it can be if you let it go too far. So I'm going to leave a list up here of some routine screening tests that patients over the age of 50 should be thinking about. And in doing some research for this, I found something kind of interesting. There's this organization called the USPSTF, the United States Preventative Services Task Force. And they're a little bit at odds with the American Academy of Dermatologists in that formal yearly skin checks aren't recommended. Now, most dermatologists would say you definitely probably should, certainly if you're high risk, but the current guidelines are for self-monitoring, and I think this may have been my 4th or 5th Mohs procedure already. No doubt I've got many more headed to me in the future, but I would highly recommend getting looked at by a dermatologist if there's any question about a lesion at all. I didn't even notice this tiny little speck, this little dot, and she picked it up very astutely. In fact, I think it had only been there a week or two when I saw her. So the treatment was very easy, very straightforward. I'll go ahead and get rid of that for you with some movie magic so you don't have to stare at it anymore. But again, routine screening's important for women, especially mammography and bone density. I can't emphasize that enough. And this is not an exhaustive list. For everyone over the age of 50, colonoscopy, and I believe now that age is 45. For women, also pap smears up to the age of 65. Getting your blood pressure regularly checked, as well as your routine labs with your primary care physician. I want to issue a special thanks to Dr. Dieter, Rosie, and the staff at Westlake Dermatology. They provided such excellent care for me. I cannot recommend them enough. Find yourself a good dermatologist, and we'll see you next time.